Okay, we're going to start with our first recorded lecture on Unit 1, Introduction to Healthcare. Make sure that you take the time to do the required reading. As you can see, it is units are a collection of chapters. It's not by chapters. So chapters 1, 2, 3, and 22, pages 400 to 402, and then chapter 28 are all included in Unit 1. So do your best to get through that reading to help prepare you for the unit and the test. So starting with this, functions of healthcare organizations. So it's important to understand the different types of healthcare that there are. There's long-term care, which is what we focus on primarily in this program. The Illinois Department of Public Health, which governs our program, is mostly focused on long-term care. So we're going to learn specifically a lot of what rolls around that or revolves around that. So skilled care, assisted living, independent living, these are things like the nursing home where we would be doing our clinicals at, things of that nature. That's long-term care. Hospitals are considered acute care, and acute meaning they're there for a small time, for a short time. So the patients require care that can't be given outside of that hospital setting. So it may be like IVs or surgery or 24-hour nursing, quality type care, ventilators, things of that nature. Then you have rehabilitation, and the goal of rehabilitation is to restore or improve function. So this would be, there's a rehabilitation unit within the nursing home where we do our clinicals at. And so when they leave the hospital, they go there. There are some rehabilitation areas within the hospital that you may stay there for a while if you were needing rehabilitation. Rehabilitation can be anything from an accident, an injury, amputation, a heart attack, and you're regaining strength and stamina to be able to go home. So it varies. It's not just the broken hips of the world. Home health is when somebody comes into the home and provides you care within the home setting. And then hospice is for a person who has a terminal illness and it's been determined that they have 6 months or less to live. Another really important part of care and the focus of where care has gone nowadays in healthcare is person-directed care. And so in the past, everything was kind of revolved around the facility. So everybody had to get up at a certain time to go eat breakfast, and everybody had to have showers at certain times on certain shifts. But now they try to make things more directed toward what is best for the person that they're caring for. So it's self-determined. It meets that individual person's needs. It's focused on what they're able to do, so on their abilities. And it's person before task. So, and it's also has to do with choice. So an example would be, if you are a person who prefers to take your shower in the morning, then you would have the choice to shower in the morning rather than in the evening. Or if you like to sleep in and breakfast is served at 7, but you like to sleep in and have your breakfast at 9, you can do that. You can still go down to breakfast at 9 o'clock if that's what your preference is. So person-directed care is something that's important to understand. And giving an example between person-directed care or task-directed care, and I kind of already said that there was a time where task-directed care was everybody gets their showers on a certain shift, on day shift. Everybody gets up and they're dressed and ready for breakfast before night shift leaves in the morning. Well, that's what task-directed care is. Person-directed care focuses on what that resident's preference is. What do they like and what's best for their life. Holistic care. This is a term that you need to know. Think about how it sounds. Holistic. So it's the person as a whole, right? It's their physical, social, emotional, and spiritual needs that are all being taken into consideration when giving care to this person. Oftentimes the focus is just on the physical. Let's fix their breathing problem. Let's fix their walking problem. But what they're not addressing is the social issues, the emotional issues, the spiritual issues. If a person is depressed, their recovery is going to take a lot longer. So the emotional issues need to be met. If a person's spiritual needs are not being met, and that's something that's very important to them, they will not have as good of a recovery or as good of a life. And of course, the social part's really important, as we've all been social distancing lately and stuck in our homes. We know how important that social component is, and that's true also in the aging, in the elderly, in the nursing homes. They really need to avoid isolation, and they need to be spending time with others. So holistic care is caring for the whole person. The interdisciplinary team is those who care for the resident. And that is pretty much everybody. We think always specifically nurses, but other people on the interdisciplinary team can include dietary, laundry, housekeeping. These people are in and out of their rooms all the time. They're interacting with the patients. The activities department, of course, social services, they are all working together to provide the best possible care for that resident. They're all very important members of that healthcare team, of that interdisciplinary team. But the most important member of the interdisciplinary team is the resident. They are the most important member of that team. So you do need to remember that. Chain of command. This is the order of authority within a facility. So if you have an issue, if you're a CNA in a facility and you have an issue, you are to go to the person who's directly above you. You go to your supervising nurse. And if the issue isn't resolved there, then you go to the director of nursing. Whereas it would be wrong if you decide to go straight to the director of nursing or the administrator of the nursing home. You have to follow a chain of command and that order of authority within the facility. Another term that you need to be aware of is liability. Liability is the legal term that means a person can be held legally responsible for harming someone else. You have to be responsible for your actions, and you can be held legally responsible if something happens. So it's important to know your scope of practice, which we will discuss today, and to follow that chain of command. If you're given an order by your supervisor to do something and it was not within your scope of practice, liability doesn't just fall directly on you, but it will also on your supervisor. So being aware, being responsible, these are all things that are part of being a CNA, but know the term liability.